Hi, everyone. I'm Anuradha Chandrasekaran, Assistant Professor at Texas Tech University Health Science Center. Welcome to this poster presentation on curriculum innovation, integrating AI and machine learning into healthcare professionals' program of study. So let's jump in. So as we all know it, AI is everywhere. AI-enabled medical devices and apps have just simply grown in number. There's not a day in the news without us hearing about AI. So we wanted to create something. We wanted to create a course that our students, faculty, as well as staff can take to gain a certain amount of working knowledge in AI, especially within healthcare, to understand the fundamentals, explore use of AI tools across teaching, research, as well as clinical practice. Now, what was also important to us was to discuss the ethical issues surrounding the usage of AI within healthcare context. So the question was, how do we incorporate it into our current curriculum, considering the variety of programs an institution like ours offers to our students? How can we make one course that connects to everyone? So that was born our AI micro-credential that we're working on offering to our students, faculty, as well as staff. And we would also like to make this available to external users outside of our school who would like to take it outside of our school, outside of our institution. Any external users, any public-facing users, we would like for them to be able to take it. So let's talk a little bit about AI competencies. And in a paper by Russell et al., she and her co-authors talk about 6 AI competencies needed by healthcare professionals. Now they come to these competencies based on the fact that they believe as AI is adopted more and more by healthcare professionals, there will be a need to acquire baseline competencies to be able to use this technology safely, equitably, effectively, and efficiently. So that's how we have these fundamental competencies that they've established. Now, these 6 competencies are foundational knowledge of AI, so they need basic knowledge of AI, some social and ethical implications and considerations while using AI in healthcare. We need to be able to explore utilization of AI-based tools from a clinical perspective, and we need to be able to evaluate AI-based tools and understand how these AI tools can be integrated into current clinical workflows. And we also need healthcare professionals to be able to participate in professional development activities using AI-based tools. So we wanted to connect this course that we're developing with the competencies acquired and also with Miller's Pyramid. So we all are familiar with Miller's Pyramid. We're talking about the knows how, the shows, and the does. And we wanted our course to connect to all 4 levels of the Miller's Pyramid, where the knows is for knowing foundational concepts, and the knows how would be they will need to reflect on that knowledge. For the shows, they need to be able to showcase their ability to create solutions using hands-on activities. Now, and the does, they're not working inside a healthcare institution to create these solutions, but they're picking a real life scenario. So they're picking a scenario like a problem in a healthcare institution, and they are going to be designing strategies and creating frameworks and implementation strategies to create AI solutions for these scenarios. So we're essentially using scenarios from healthcare institutions for that specific level of the Miller's Pyramid. So how do we connect these competencies by Miller's Pyramid to the AI competencies and to the Miller's Pyramid, and how do we come up with a course, right? So our solution was to modularize it and create separate badges that connect each level of the Miller's Pyramid to a foundational, to a level, to a badge level, essentially. So the foundational level would be your nose, and then we would have a bronze level badge for that, which should be basic knowledge of AI and machine learning. And then we would still discuss social and ethical implications surrounding the use of AI and machine learning. And that would be part of that badge as well. And for the next level, the knows how, we're going to issue multiple silver level badges. So in this case, because we have teaching, research, and clinical practice, we want to make that into multiple specializations. So we're offering different silver badges for each one of those teaching, research, and clinical practice specializations. And here we're basically there's a lot of reflection. So you have the knowledge, you know how to use these tools. We're going to be looking at tools and strategies of how AI-based tools can be used in teaching, research, as well as clinical practice. There's going to be a lot of reflection around that. And for the third level of shows, we're issuing a gold badge. And this would consist of actually running machine learning algorithms using healthcare data sets to gain an overview of its internal workings. And for the final level of DOS, again, as we just said, it's going to be a gold badge, and we're giving our learners the ability to use real life scenarios within healthcare institutions, and then design and develop an AI solution and incorporate it. So they have to come up with these strategies of incorporating an AI solution within a clinical workflow to solve a specific problem and then present a report. So we do have overall learning objectives for the entire course, and they are our learners should be able to understand and explain the fundamentals of AI and machine learning within the context of healthcare data. They should be able to determine how best to integrate and use AI-based tools in teaching, research, and clinical practice. Again, those three different specializations. And also, they need to be able to gain practical skills in using AI tools and techniques. So they're running AI algorithms using health-related data, and they're also running some data analysis using the health-related data as well. So, and they also should be able to identify ethical and security issues concerning the use of health-related data by these AI-based tools. So, and now when we come to each badge, because we have 4 levels of badges, but we have 6 badges overall because we have the silver badge split into 3 different specializations. Each badge, of course, has its own learning objectives and course requirements and course completion requirements, all of those things. So if we looked at the first badge, the very first bronze badge, it's basically introduction to AI and machine learning within healthcare. And we have designed it to introduce learners to the core concepts of artificial intelligence and machine learning within a healthcare context. And we're also delving into critical discussions on data privacy and ethical issues. And then we come to our silver badges, right? So we have 3 different modules in there. So we have the clinical practice, the teaching, and the research, all split into multiple silver badges. And so here also, our objectives are to be able to explore AI tools and strategies and how it's being used in teaching, research, and clinical practice. We'll be delving a little bit into creation of prompts as well, using conversational agents like large language models, and we'll also be examining ethical usage of these large language models in the context of teaching and research. We'll be examining the role of AI and AI-based tools in diagnosis, treatment planning, and patient monitoring. And we'll also be identifying potential steps of how we can incorporate machine learning into clinical workflow. So that all forms a part of those badges. And then going further, now this goes a little bit deeper, right? So because we're now at the shows level, here we're calling it AI in action, where we are going from algorithms to healthcare insights, and our learners acquire practical skills in predictive modeling, using various healthcare data sets and machine learning algorithms. So those the images that you see on there, those are the machine learning algorithms that we'll be going over. And we're also going to be focusing on natural language processing and image analysis. And our learners gain foundational knowledge of predictive analytics, neural networks, related algorithms, applying these methods to healthcare data, but also recognizing their limitations. And finally, the badge introduces concepts like precision medicine, personalized medicine, multimodal data integration, and current applications of personalized therapy. And then we have finally the last badge, which is another gold badge. And here we've incorporated a module on AI strategy because it becomes really important for strategic development and deployment of AI solutions. So how do we synthesize the knowledge we've learned from all those previous badges? And these badges have to be taken in order. So if you're taking this gold badge, you would have had to take the bronze badge and one of the silver badges and the other gold badge as well, because here we're synthesizing knowledge extracted from all the previous levels, and we're going to be developing strategies for integrating AI-based solutions into existing workflows. And here we're also going to be talking about building augmented systems along with evaluation frameworks, guiding principles to ensure effective and ethical AI adoption. And learners will again examine challenges, limitations, applying critical thinking to real world scenarios. And then we have a final comprehensive project where, again, our learners showcase their ability to design AI-driven solutions and device implementation strategies. And they'll also have to present their work to relevant stakeholders. Now, in each section, in each module, in each batch, we're not only going to go over the what, the why, and the how, and all that, but we will also be going over limitations, caveats, things to keep in mind, challenges which arise with pretty much every implementation, and what could be potential solutions, future directions, use cases, all of those things. So, having said all that, the next thing is to think about, okay, how do we assess this, right? Assessment. And for the very first level, which is the bronze badge, which is the nose level, it's assessed using multiple choice questions, which is MCQs on AI and ML. And for the nose how, we are going to be using, because they have to know how to use AI-based tools and they have to reflect upon the usage. So it's not just the knowledge, they have to reflect upon its usage. So yeah, so that's the other thing. So they have to do a lot of critical thinking, and in terms of how to use AI and why are we using AI, what could be the risks versus benefits, and things like that for teaching, research, as well as clinical purposes. Now, the shows level is where we assess by assignments that need both critical reflection as well as practical implementation of multiple machine learning algorithms. And for the final dust level, again, we have the comprehensive final project where they have to design and come up with implementation strategy to create a comprehensive AI solution. Now, moving over to hands-on activities, we have several assignments that enable our learners to run machine learning algorithms on real world data sets. And we're able to implement and showcase natural language processing NLP solutions on drug sentiment data, and also run image analysis algorithms on chest X-ray data. So one of the images that you're seeing right there is actually, it's from the Orange data mining software. The reason we used it is because we did not want the to learn to code to be an obstacle for running machine learning algorithms or understanding this. So we wanted to create a no code environment. And Orange data mining is available to use for educational purposes, and that's what it does. It gives you a no code environment. It's all visual widgets. You can pick and choose those widgets for working with your data, data transformation, and data source, getting the data from the source, data transformation, applying machine learning algorithms, checking accuracy. All of that can be done in just a visual way. So, and then we're going to be doing all this using real world healthcare data sets. We're going to be using breast cancer data, chest X-ray data, and drug sentiment data to be running those analysis. And we're also going to be doing reviewing AI tools and platforms. We'll be exploring challenges, barriers, proposing solutions, integrating these tools and ideas. Possibly, how are we going to do it in the current clinical workflow? So we're going to be talking about all that. And the final comprehensive project that you see here, we are going to be picking a real world scenario. And again, we leave this to our learners. Our learners will be picking a real world scenario in their field, maybe where they are situated. And they're going to be looking at a problem and then justifying why this could benefit from applying an AI solution. And then they'll work on creating an implementation strategy that takes workflow integration into account. Now, one of the more important things that we're also doing here is we're evaluating ethical challenges. We're enabling our learners to evaluate ethical challenges. So they have to do that. And they'll be working on proposing a policy framework around such challenges. And once they're done with all that, they will be creating a report or a presentation in a way like as though they're presenting it to a panel of stakeholders like healthcare professionals, patients, and hospital administrators, and all of those people who are involved in this problem and in the solution, in integrating this solution. Again, also keeping in mind there could be technical as well as non-technical stakeholders. So how do we do that? So that's what we're trying to bring into this final comprehensive project, synthesizing everything we've learned before and coming up with a solution to a problem that they encounter in their field. So, and we're not stopping with that. So we have a lot of work that we are planning on doing with this with this AI micro-credential, we would like to continue to create modules for multiple programs. We have so many different programs within health professions. So how do we, so maybe they take this generic module, and then how do we create something that is specifically for a specific program? We make it tailored towards them. And how do we do that? So that's one of the things we're looking at. And we also want to be able to tailor these modules for undergrad, graduate, as well as PhD requirements. And we want to hear from you. We want to hear from our learners so that we can understand better what we can change or add that would help learners better in their professions. So there's a QR code right there. If you scan the QR code, it will take you to an information page, which again lists all of these badges that we just talked about and what it contains, learning objectives, course completion requirements, time commitment, all of that is there. Now, if you fill in your information and what badge are you interested in and all that and send it, it'll come to me basically. You can also connect with me directly. My email is on there on the form. So it'll come to me, and when we get all this set up and running, we're ready to go, we can send you an email and figure out how you can register for it. So yeah, we really want to gain feedback from our learners to see what more we can do. And we also want to go forward to establish an AI literacy framework for health professionals. So based on this and after creating modules for multiple programs, tailoring it and all that, this is one of the first steps in establishing an AI literacy framework for health professionals is how we see it. So yeah, so if you feel like you or your students or your faculty, anyone at your institution could benefit from this, please feel free to contact me, Anuradha Chandrasekaran. Scan this QR code, enter your information, select one or more badges, and we'll get in touch with you. So again, thank you for giving me this opportunity to present this. I really appreciate it. Thank you.